Have you ever caught yourself standing in front of the mirror during a quiet, private moment and noticed that things don't quite feel as robust as they once did? Maybe it wasn't sudden. Maybe it crept in slowly over months or even years, a subtle loss of fullness, a delayed response, a feeling that something you once took for granted now requires more effort or sometimes doesn't respond at all. And if you're being completely honest with yourself, maybe a small voice in the back of your mind has already started whispering something dangerous. This is just aging. This is what happens after 60. I guess this part of my life is over. Gentlemen, I need you to stop right there. Because that belief, while it feels true, while it seems inevitable, is not only incomplete, it's often wrong. What if I told you that one of the most powerful tools for restoring blood flow, fullness, and vascular responsiveness has nothing to do with blue pills, injections, or overpriced supplements hiding behind flashy marketing and exaggerated promises? What if I told you it's already sitting in your kitchen? I'm talking about sodium bicarbonate plain, simple baking soda. My name is Dr. Lila Romano. I'm a board-certified urologist, and for over a decade, my clinical work has been dedicated almost entirely to helping men over 50, 60, and 70 protect their prostate health, sexual wellness, and long-term vitality. Now, I know exactly what you're thinking. Doctor, baking soda? Really? How is something I used to bake cookies or clean my sink supposed to help my performance? Stay with me, because in today's video, I'm going to walk you through 5 clinically grounded, often overlooked ways bicarbonate can support vascular health and what happens to size, responsiveness, confidence, and reliability when blood flow is no longer restricted. Before we go any further, take just 2 seconds and let me know in the comments where you're watching from. Okay, now let's address a damaging myth head-on, because this belief is holding millions of men back. There's a widespread assumption that once a man passes 65, his body naturally shrinks, weakens, and shuts down, and that nothing can be done about it. That belief is deeply ingrained in our culture. It's whispered in locker rooms, assumed in doctors' offices, and accepted as an inevitable fact. But here's the truth. It's not biologically accurate. In many men, what looks like permanent loss is actually vascular restriction. Let me explain what I mean. Imagine your arteries like garden hoses. Over decades, inflammation, oxidative stress, and acidity create stiffness in those vessels, like a kink in the hose. When that happens, pressure drops, flow decreases, responsiveness fades, and tissue appears smaller and less firm. But the hose itself hasn't disappeared. It's still there. It just needs clearing, not replacing. This is why my approach has never been about miracle cures or false promises. It's about optimizing your internal environment so your body and any prescribed medications you might be taking can work the way they were designed to. And this is exactly where bicarbonate enters the conversation. So let's talk about the first method, and this one surprises most men because they've never heard of it before. Your skin is not a solid barrier. It's a semi-permeable membrane. When tissues become congested with metabolic waste and localized acidity, elasticity suffers. The blood vessels beneath the surface struggle to expand freely. By using a localized alkaline soak, you leverage something called osmotic pressure to gently rebalance tissue pH. When inflammation eases, the microvasculature opens up. Elasticity improves, and blood volume increases naturally. It's like removing a tight rubber band from a sponge. Suddenly, it can absorb again. Here's exactly how to do this safely and effectively. Take 2 tablespoons of aluminum-free baking soda. Make sure it's aluminum-free, because that matters for long-term health. Add it to a basin or container filled with warm water, ideally around 98 to 102 degrees Fahrenheit. That's roughly body temperature to slightly warmer. You want it comfortable, not hot. Dissolve the baking soda completely by stirring it well. Then, in the privacy of your own space, soak the area for 10 to 15 minutes. Do this 2 to 3 times per week. What you might notice during the soak is a slight tingling sensation or gentle warmth. That's completely normal. It's a sign that circulation is improving and the tissue is responding. After the soak, rinse the area thoroughly with clean water, pat it dry gently, and if your skin feels dry afterward, apply a natural moisturizer. Important warnings. Avoid doing this if you have any broken skin, cuts, or active infections in the area. And always rinse thoroughly to prevent any irritation. Now, here's what men often report, and this part is just as important as the physical changes. Within the first week, many noticed improved tissue appearance, a subtle increase in fullness that wasn't there before. By weeks 2 to 4, responsiveness improves. But there's something else that happens, something unexpected. There's a psychological relief that comes with it. When tissue looks healthier and responds better, confidence begins returning quietly and naturally. You stop avoiding intimacy out of fear. You stop second-guessing yourself. And that shift, that mental shift, can be just as powerful as the physical one. Now, while that topical approach works on the outside, we need to address what's happening inside your body, because this is where most men are unknowingly sabotaging themselves. As we age, kidney efficiency declines. This is just a normal part of aging, but it contributes to something called low-grade metabolic acidosis, a condition where your blood becomes slightly more acidic than it should be. And this is linked to muscle fatigue, stiffness, and most importantly for this conversation, vascular constriction. Here's what's happening. Acidic blood physically tightens your blood vessels. When your internal pH drops even slightly below the normal range of 7.35 to 7.45, your smooth muscle tissue, the kind that lines your arteries and controls blood flow, begins to constrict. It's like trying to run a race with a belt pulled too tight around your chest. Everything still works, but it's working under unnecessary resistance. Bicarbonate acts as a buffer. It nudges your internal pH back toward balance, and when that happens, it sends a signal to your smooth muscle tissue to relax. Relaxed vessels mean better volume, better response, and less internal resistance. Many men describe this shift as feeling fluid again, like releasing a parking brake they didn't even know was engaged. So here's the exact protocol for internal alkalizing. Take 1/2 teaspoon of baking soda and add it to 8 ounces of room temperature or warm water. Do this in the morning on an empty stomach. Here's how to prepare it step by step. Measure the baking soda carefully using an actual measuring spoon. Don't just eyeball it. Add it to the water and stir. You'll notice it fizzes slightly. That's completely normal. Drink it steadily over 2 to 3 minutes. Don't rush it. And then wait at least 30 minutes before eating breakfast. Now, I'm not going to lie to you, the taste is slightly salty. Some men don't mind it. Others find it unpleasant. If you fall into the second category, add the juice of half a lemon. It improves the taste significantly and actually enhances the alkalizing effect, which we'll talk more about in a moment. Important warnings. If you have high blood pressure or you're on a sodium-restricted diet, consult your doctor before trying this. If you're taking medications for heart conditions, blood pressure, or kidney function, check with your physician first. And if you experience persistent GI upset, bloating, nausea, discomfort, stop and reassess. Most men tolerate this beautifully, but listen to your body. Now that you understand how alkalizing the internal environment helps open the pipes, we need to talk about something just as critical: why so many men are doing the right things and still not seeing results. Many of you watching this video are not careless about your health. You've tried supplements. You've bought nitric oxide boosters, beet powders, L-arginine, L-citrulline, maybe even prescription medications. You've spent $40, $50, $80 a month hoping for consistent results. Yet the results feel inconsistent, weak, or short-lived. And here's what I need you to understand. That's not because those tools don't work. It's because they require the right internal environment to function. Let me explain. Nitric oxide is the master signaling molecule for vascular dilation. It's the chemical messenger that tells your blood vessels to relax and open wide so blood can flow freely. Without nitric oxide, erections are physically impossible. It's that critical. But here's what most men don't know. Nitric oxide is incredibly fragile. In an acidic, inflamed bloodstream, it breaks down almost immediately. Research shows that in acidic conditions, nitric oxide can degrade in seconds, whereas in a balanced pH environment, it remains active for minutes. Think about that difference. It's like trying to light a match in a windstorm versus lighting it in a calm room. Same match, completely different result. Bicarbonate doesn't create nitric oxide. Your body does that. What bicarbonate does is protect it by buffering acidity and reducing oxidative stress. When you do that, nitric oxide remains active. Longer. Instead of brief spikes in blood flow followed by rapid fade, you get sustained dilation, better volume, and more consistent responsiveness. Instead of fireworks that disappear in seconds, you get steady, reliable warmth that lasts. Here's the timing strategy that makes all the difference. Take your bicarbonate drink about 20 to 30 minutes before consuming nitric oxide boosting foods or supplements. Think of bicarbonate as the stage crew preparing the environment so the actual performance can happen. And when it comes to nitric oxide-rich foods, focus on beets, dark chocolate with at least 70% cocoa, watermelon, pomegranate, and leafy greens like spinach. When you combine proper pH balance with these foods, the effects multiply. Now, there's another process that many men have never been told about, and it's quietly destroying vascular function in millions of men over 60. It's called inflammaging chronic, low-level inflammation that builds slowly over decades. This type of inflammation doesn't cause sharp pain or obvious symptoms. You won't feel it the way you feel a cut or a bruise. Instead, it quietly changes tissue structure, leading to something called fibrosis, which is the development of stiff, non-elastic tissue. Here's why this matters so much. Even with good blood flow, fibrotic tissue cannot expand properly. Imagine the difference between a fresh rubber band and one that's been sitting in a drawer for 10 years. The old one has lost its stretch. It's brittle. It doesn't respond the way it used to. That's what fibrosis does to vascular tissue. And the frightening part is that most men don't even know it's happening until function has already declined significantly. Bicarbonate has been shown in clinical studies to reduce inflammatory markers, such as C-reactive protein, which is one of the key indicators of systemic inflammation. When inflammation decreases, tissue elasticity improves, expansion capacity returns, comfort increases. And there's also a psychological shift that happens when your body starts responding predictably again. That anticipatory anxiety that so many men carry, the fear of, will it work this time? It starts to fade. Your body stops feeling like an opponent you have to fight and starts feeling like an ally you can trust. For this, I recommend what's called a pulse approach. Take 1/4 teaspoon of baking soda daily for 5 days, then take 2 days off. This cycling approach supports balance without suppressing your body's own natural buffering systems. Your body is designed to regulate pH on its own, and we want to support that system, not override it. Now, one of the most balanced and effective ways to use bicarbonate is in combination with fresh lemon juice. This is the protocol I recommend most often to my patients because it's simple, it tastes better, and the synergy between the two ingredients is remarkable. Here's the recipe. Take 8 ounces of filtered water. Warm water works best because it helps everything dissolve more easily. Add 1/4 teaspoon of baking soda and stir until it's completely dissolved. Then add the juice of half to 1 fresh lemon. Stir again. Drink this about 20 minutes before breakfast. Here's why this combination is so powerful. The potassium in the lemon balances the sodium in the baking soda. The citrate from the lemon enhances alkalinity, and the bicarbonate buffers acidity. Together, they create a synergistic effect that's more powerful than either ingredient alone. Men who use this consistently often report improved morning responsiveness and better overall consistency throughout the day. Most notice changes by week 2 or 3. But there's something deeper happening here as well. Starting your day with this intentional ritual sends a powerful signal to your nervous system. My vitality matters. I'm taking control. I'm investing in myself. And that mindset shift often leads to better food choices, more movement, better sleep, and greater self-respect. Those changes compound over time, and before you know it, you're not just treating a symptom, you're transforming your entire approach to health. Now let me give you a clear, phased action plan so you're not overwhelmed trying to do everything at once. For the first 14 days, I want you to focus only on internal chemistry. That means the morning lemon and baking soda drink. That's it. No stacking multiple protocols. No chasing sensations. Think of this phase as clearing the rust from the pipes. You're resetting your internal environment. During these first 2 weeks, here's what to monitor: your overall energy levels throughout the day, the quality of your morning fullness, and even your urinary flow. Many men notice improvements here as well, which is a bonus benefit. Common experiences during days 1 and 2 include possible slight bloating, but this normalizes quickly. By days 3 to 7, you'll likely notice subtle energy improvements. And by days 8 to 14, you should begin noticing morning changes. From day 15 to day 30, continue the morning drink. That's non-negotiable. It's your foundation, and now add the topical soak twice per week. I usually suggest Sunday and Wednesday evenings, or whatever works best for your schedule. Just keep them spaced a few days apart. And here's a timing tip: allow at least 6 hours between the soak and any planned intimacy for optimal effect. This is when internal chemistry improvements begin translating into tissue responsiveness. This is the phase when men report the most noticeable changes. If you do nothing else from this entire video, stick with that morning drink. That internal pH shift is the single most powerful lever for vascular health. Everything else, the soaks, the timing strategies, the food pairings, those are enhancements. They're valuable, but the foundation is that daily morning drink. Now, I need to be completely honest with you about expectations, because I care about your long-term success more than I care about you clicking subscribe. You are not going to wake up tomorrow morning with the physiology of a 22-year-old. That expectation only leads to disappointment, frustration, and giving up too soon. But that's not what this is about. Here's what men actually notice. In weeks 1 to 2, increased warmth and a subtle feeling of fullness. In weeks 3 to 4, improved morning responsiveness and better reliability. Between weeks 4 and 8, more consistent performance and reduced anxiety. And ongoing. A sense that your body feels like an ally instead of an opponent. That anticipatory anxiety that many men carry, the fear, the doubt, the avoidance, it starts to fade. That's real success, gentlemen. This isn't about fantasy or chasing some impossible standard. It's about protecting function, confidence, and dignity. It's about reclaiming what's rightfully yours and refusing to accept decline as inevitable. Drop a comment below right now and tell me which step you're starting with. I read every single comment, and I love hearing from this community. Share this video with one man in your life who needs to hear this message, but won't ask for help. I'm Dr. Lila Romano, and I will see you in the next video.